Hello, my name is Camila and I'm going to talk about ADHD and Ritalin. ADHD stands for Attention Deficit Hyperactivity Disorder and is generally diagnosed during childhood. It affects between 8 and 10% of young kids and teenagers, although it mostly affects boys rather than girls. Symptoms of ADHD during teenage years include distractibility, irritability, poor concentration, hyperactivity, impulsivity, and insomnia. These are intensified because of the hormonal changes of adolescence. In addition, ADHD can coexist with learning disabilities, mood and anxiety disorders, among other conditions. ADHD causes teens to feel isolated and somewhat excluded from society. Since they have poor concentration, difficulties in school, they tend to be forgetful, they feel bored with their daily classwork, and are either inattentive or excessively attentive. ADHD leads to poor performance in school, athletics, and even within their own peer groups, for they tend to have difficulties making friends. Besides, ADHD patients have a greater risk of car accidents, drug and alcohol abuse because of impulsivity. Some people believe that ADHD results from a lack of attention given to children by parents and teachers, but new research has showed structural differences in the brains of children suffering from ADHD. Through MRIs, magnetic resonance imaging, it was revealed that boys afflicted with ADHD have more symmetrical brains and with a 5.3% smaller right hemisphere of the brains than boys without the disease. It is not precisely known exactly how this difference in brain structure and size results in ADHD, but it is believed that some functions of the brain are affected, resulting in an inability to inhibit thoughts and actions. Generally, ADHD is treated with behavior therapy and medication. The majority of these medications are meant to strengthen the dopamine signals in the brain, which increases the reception of this neurotransmitter, dopamine. One of the most common methods of treatment is methylphenidate, commonly known as Ritalin. Controversy surrounds the usage of this drug, mainly because Ritalin is classified as being in the same family as cocaine and is very similar in chemical structure, metabolization, and clinical effects to amphetamines. It can improve attention span, decrease distractibility, increase ability to finish tasks, improve ability to follow directions, decrease hyperactivity and impulsivity. It also helps legibility of handwriting, completion of schoolwork, and it decreases aggression and stubbornness. It has been shown that therapy can have the same positive long-term effects on the patients and that Ritalin is only a quick fix, for it lasts only a few hours. Ritalin has helped teenagers manage their emotions better and interact with their peers in a positive way. Patients no longer suffer of exclusion and failure in their activities, thanks to Ritalin and other medications. Despite its positive effects, Ritalin is known to have very strong side effects, such as nervousness, insomnia, loss of appetite, as well as developing a very strong addiction to the medicine. Recreational drugs, such as nicotine and cocaine, temporarily increase brain dopamine activity, which explains why ADHD patients tend to be prone to drug addiction. Ritalin use in teenagers and children is very risky, for it can suppress growth, severely alter the brain development, and cause heart disease if taken for long periods of time. Overmedicating can be counterproductive and have opposite effects to the desired ones, such as suicidal tendencies, mood swings, personality changes, and, of course, drug abuse. Ritalin can also cause sudden heart attacks, like cocaine. This medicine is particularly dangerous with emotionally unstable patients, for they may increase dosage by their own initiative. The abuse of Ritalin can lead to psychic dependency and needs careful supervision during drug withdrawal, since it can cause severe depression. Since teenagers naturally seek peer approval to fit in, the use of Ritalin as a recreational drug has become more and more popular. Since this medication is easy to acquire, it has become not only a commonly used drug, but also a transitional drug for patients who start over-medicating themselves and then continue on to harder drugs. The use of Ritalin, regardless of its many negative effects, causes a lot of controversy. Some believe that it is a drug that just helps kids and teens get through school. And since the number of Ritalin users is growing, it can be assumed that the school system needs to be updated to meet the interests and needs of the new generations instead of drugging them throughout their time in school. Ritalin has no long-term effects that therapy does not have, which means that it is not needed other than for success in similarly important activities. Just as recreation drugs are used during parties, Ritalin has become the legal drug used during school. Also, cocaine and amphetamines are illegal, and there are very strict laws that deal with the production and consumption of these drugs. Thousands of people die every year in drug trafficking-related accidents, and Ritalin has almost the same effects as these drugs. So, if cocaine and amphetamines are so important to fight against, then why are kids and teenagers buying similar drugs at the pharmacies? Some street names for Ritalin include Ritz, poor man's cocaine, smart drugs, and kiddie cocaine, which show the use of this drug for recreational purposes. There are other ways of treating ADHD that do not risk the patient's safety and control. Perhaps they're not as effective in the short term, but it is up to the user or the parent of the user to ponder on what is most convenient for them: immediate relief or long-term well-being. Thank you.